I'm Dr. Scholl of GastroDirect and the Happy Gut Club, and this is my YouTube channel, so thank you for joining me. I'm talking to you this morning about a really cool topic called histamine intolerance. This is a condition that is often overlooked as a cause of IBS symptoms, and it's a little bit complicated, but I'm going to break it down for you as best I can. Histamine intolerance is a condition that causes symptoms throughout the body, but because 75% of our histamine receptors are in the gut, this is a major area where symptoms can manifest. You get diarrhea, bloating, abdominal distension, gas, and abdominal pain. And I was surprised to learn when I did a deep dive that half of patients actually have constipation. There can also even be nausea and vomiting. As I said, this is an often overlooked cause of IBS symptoms and one that traditional medicine is only now coming around to. HIT can be thought about in the same way that we think about lactose intolerance. So histamine is present in foods and requires an enzyme called diamine oxidase, or DAO, to break it down. And when we don't have enough of this enzyme, that's when we get the symptoms. Histamine is found in high levels in lots of different foods, and that's what makes it difficult to diagnose, because the range of foods that it's included in is hard to predict. They're so disparate, so different. So histamine is in high levels in canned fish and shellfish, chocolate, leftovers because of the action of bacteria, fermented foods like cheese, salami, beer, and bread, especially things that are fermented by yeast, and even in peanut butter and peas. When we take that in, if we don't break it down, it goes on to do what histamines do. It turns on our allergic system. And since most of our histamine receptors are in our small intestine, when they get turned on, you get bloating due to congestion in the wall of the small intestine, diarrhea from the release of lots of water into the intestine, similar to a runny nose, and pain related to the bloating and diarrhea. And these symptoms typically have their onset within 4 hours of ingestion of the food. So if you had the food at lunch, you can expect to see symptoms by dinner time. In addition to the consumption of histamine in foods, some people's microbiome makes histamine. And this might be a sign of dysbiosis, where you have an imbalance of bad to good bacteria. With their DAO enzyme already busy with the histamine that they're creating in their own body, any additional histamine from the diet can trigger symptoms in these people. Probiotics often contain these types of bacteria, so it's best to avoid taking probiotics if you think that you might be dealing with this issue. In addition to diet and your own microbiome, HIT can be triggered after use of medications that cause a loss or reduction of the DAO. So in addition to the gut, there are histamine receptors in the skin. So you may get facial flushing, itching, or splotchy skin. And there are also receptors in the lining of the brain, so headache is common. And so DAO capsules or an antihistamine typically help in this kind of headache. You might also have a runny nose, wheezing, or asthma type symptoms similar to typical seasonal allergy reaction. And even heart palpitations or rapid heartbeat, although those are less common, and even painful menstrual periods. We see histamine intolerance in anything that can harm the lining of the gut, because that's where the DAO enzyme resides. So we see it in celiac disease, and this is often a cause of persistent symptoms even when people are on a gluten-free diet. We see it in Crohn's disease and in chemotherapy as well. This may be why dysbiosis as well is a cause. Unfortunately, there's not a good test for diagnosing HIT. I typically ask a bunch of questions, screening for histamine reactions, and if we think it likely, we look at a sheet containing histamine-rich foods to see if there are known triggers for you. And this is often an aha moment where we think, oh, okay, maybe this is what we should be pursuing. So we do a trial of a low histamine diet, and this typically will calm your symptoms down if we're on the right track. We can also test your serum levels of DAO, but this is not a very reliable test. But if your levels are low, we can use a DAO replacement enzyme with an expectation that it will help your symptoms and that we may need it long term. Some people also need an antihistamine. The use of which one depends on which symptoms you're having. If you're having more allergic type symptoms, then Zyrtec can help. And if you're having more GI symptoms, then something like famotidine or Pepcid can help. And you typically need doses that are higher than what you see on the label, so it's best to talk to a doctor about it. Interestingly, people with Ehlers-Danlos and POTS are more likely to have HIT for reasons that we don't understand. It's so true about so many people with Ehlers-Danlos and POTS. There's a lot of unknowns in those conditions. The way to approach HIT is threefold. Avoid foods that are highest in histamine, use an enzyme to break down any that gets in, and use an antihistamine like Zyrtec or Pepcid, depending on what symptoms dominate, to block receptors that histamine would otherwise bind to. People with true histamine intolerance usually get better after 2 to 4 weeks on the diet, and then they should work on liberalizing their diet and stopping their antihistamine. This is best done, of course, with the guidance of a knowledgeable dietitian and or GI doctor who is knowledgeable about the subject. And in addition, many people benefit from DAO, enzyme supplementation. These are typically available on Amazon, not at your local grocery store or drugstore. I've never seen it there. So I hope this helps. I find a lot of this in my clinic. It's just a source of very random, frustrating, anxiety-inducing symptoms that Western medicine is not really up to speed on. This is something that I always screen for. I hope that this helps. As always, thank you for watching to the end, and I look forward to teaching you again sometime soon. Have a great day.